All right, so TrumpRx.com launched, I think yesterday. So here's my hot take on it. I gotta say I'm disappointed. So let me walk you through why. So TrumpRx.com was billed as this big endeavor for the Trump administration to lower the price of prescription drugs. As you guys know, like I'm not political necessarily, so I've been very pro-Trump on several things and have been critical at times too. So um, I'm fairly neutral, but this disappointment. Some good things. Number one, he was able to get the price of GLP-1s down. Now, in reality, what had happened was GLP-1 prices had been coming down, often because of pressure from organizations like Big Tree, compounded medications that were way cheaper. The prices that they have got down to are still, 30 to 50% higher than what we are charging patients currently. But these are the branded meds. We use compounded meds, which are similar but not the same. I'm a big fan of how we do things, obviously, because I'm doing it that way. And I think there's a lot of advantages to it over the branded meds. But if you really want branded meds, TrumpRx.com basically just creates a link to the manufacturer coupon systems that were there before. So, did Trump do that negotiation? I guess so. But you can certainly find those here. Now, is that all it does? No, there's a whole bunch of other branded meds that are available on TrumpRx.com, except the fact that most of them have generics. So branded meds, so let's use fluconazole diflucan. So fluconazole is the chemical name, the actual chemical, and diflucan is the branded med, okay? Or esomeprazole is the drug name, and Nexium is the branded med. So so you get a trademark on your pill, Nexium or diflucan, for depending on a bunch of variables, let's say 7 to 10 years, and then after that, anybody can go make it and sell it as the off-brand or the generic, right? So you can go to a Walmart now and buy esomeprazole, or you can buy branded Nexium, and they have to be legally the same thing. So what TrumpRx.com has done is it is selling branded meds, but many of them are things that also have generics available. So diflucan, which is something that we often use for yeast infections in women, we use it for other things. As a pediatrician, I use it for thrush in babies. The fluconazole generic is out there. It's dirt cheap. It's on our $1 list at Big Tree. Well, they are proudly announcing that diflucan is 50% off. It's down from $28 to $14 on TrumpRx.com, which is still not a good price. Or they've got Protonix on here, which is a competitor of Nexium. It's an antacid. And they proudly announced that the price has gone from $447 to $200. Now, mind you, at Big Tree Pharmacy, it's $1. Okay, and we have the generic. So do we have Protonix branded? No, because why on earth would you buy that? So there's a whole bunch of these on here. I think there's a couple of mixed in as well that prices have come down some, the cash prices, but like Medrol is on here, which is Medrol is like the Medrol dose pack, the steroid methylprednisolone. Nobody writes for branded Medrol, so the 50% off thing on here is like completely irrelevant. So anyway, a lot of that on here, plus some GLP-1 prices. It lists an insulin on here that's very affordable, but that was already available and has been for like a year or two. So all is to say, pretty big disappointment. Of course, we're thankful for lower prices on branded GLP-1s. We use that to help push down our prices with our manufacturers so that our patients now, like our starting doses are like $100, under $100 a month, even for tirzepatide. And then, we do things where we're able to custom dose it and add some things to it to decrease side effects, which we think creates a much better product than what is available on the branded system. And, we have patient data to prove that. But regardless, I'm pretty disappointed in this. I'm thankful that the federal government is trying to address drug prices. Apparently what they did with PBM reform earlier this week was super impressive. That's a bit out of my wheelhouse to understand, but this, not the greatest. So a lot of political capital gained probably, but not a lot of savings for actual patients.